Thank you, Sophia, and thanks for everybody being on the Zoom today. I want to thank Dr. Rashad Collins, CEO of Neighborhood Healthcare, for being here, Matt Coleman from CEO of Skyline Health, Kim Cliff, you're going to hear from Tri-State Health. She's the CEO, Lynn Kimball, who was Executive Director of Aging and Long-Term Care in Eastern Washington, and Dr. Rachel Zaka, who is with the Fred Hutchinson Cancer Research Center, and Jacqueline Blanco, who is in obstetric nursing. We're here today to talk about the impending Medicaid cuts that, if the House of Representatives and the Senate are successful, would saddle Americans with additional financial strain. We know that more than 72 million people have access to Medicaid, making it the largest insurer in the United States, and it's also a critical part of our healthcare delivery system. Depending on the state, the federal government's partnership with your state could be anywhere between 50 and 77% of the cost of insuring people, and that is why we're so concerned about these proposed massive cuts to Medicaid. While Medicaid is administered jointly by the federal government and the states, about 2/3 of the funding of state Medicaid programs usually is federal. So that means it's the largest source of funding for states, the largest component of expenditures across states, more than K through 12, higher education, or transportation. So to be fooling around with something this big and saddling the states with more cost is not the way we need to go. The House Republicans are now trying to cobble together what I believe is a serious attack on Medicaid, and these will have impacts across our economy. It undermines the program by shifting the burden to the states and making the entire healthcare system more expensive. When you think about it, if you cut Medicaid and you cut people on Medicaid, they're not going to stop having healthcare needs. They're just going to go to a more expensive, unfunded setting to get that care. Medicaid provides the critical financial support for the healthcare sector and for our economies to keep going every day. So taking that money out of the system is literally like taking money out of the economy, particularly at a time when we're still recovering from inflation. The multiplier effect of Medicaid is more than $1 for every dollar that is spent in a multiplier effect, and Medicaid drives employment across the healthcare sector. If you don't have coverage of Medicaid, I'm sure we're going to hear from the various panelists today, not sure how they're going to provide the health care that they need for the communities writ large. Reductions in funding, especially as large as $715 billion, as we see in the House bill, will have a take on our state's revenue, on our jobs, and it will increase the financial burdens of families at a time when we cannot afford it. The Medicaid recipients are part of a system that literally doctors, hospitals, pharmacies, and nurses depend on to serve them. If you cut Medicaid, you're literally going to cut these services, you're going to cut food supplies, you're going to cut the supply chain, and then impact the rest of the population that has to have access to those same services. So make no mistake about it, cutting Medicaid will also hurt our economy. It will hurt federally and it will hurt at the state level. The Commonwealth Fund estimated that collectively states' gross domestic product could see as much as a $95 billion reduction. That means almost $2 billion per state could be cut out of your system, and thereby leaving the state really even no means to make up the difference. The loss of individual business income would mean that a state and local revenues could be revenues from other sources related to our economy could be reduced by $7 billion. So I'm pretty sure we all saw the news from today on what the state was doing. So I doubt we can afford either the $2 billion more expense or the $7 billion loss in revenue from taking money out of the system. This plan will cost our consumers and will be costly for our hospital network. The reconciliation bill also prohibits states from enacting new provider resources. It caps the direct payment program. So basically, you're tying the hands of states as you reduce revenue. Immediately, once this bill would pass, states would be restricted in their ability to fund their Medicaid programs and would have to decrease the amount of their federal support. In addition, the work requirements have been tried in various states and literally have been nothing more than throwing tens of thousands of people off of Medicaid. Most states who tried it have reversed it because it was not a successful program and it didn't provide the necessary coverage for Medicaid outside that is so necessary to our communities. So I'm going to stop with that and thank our panelists for being here and start with Rashad Collins, CEO of Neighborhood Healthcare. Rashad, thank you.
Thank you, Senator, and appreciate the opportunity to be here and want to thank you for all of the work that you continue to do on behalf of Washingtonians. My name is Rashad Collins. I'm the CEO at Neighbor Care Health. We are a community health center providing medical, dental, behavioral, and pharmacy services to nearly 60,000 patients across 30 clinics located in the greater Seattle area. Medicaid is most certainly the backbone of our system and provides essential healthcare access to the patients we see every day. Nearly 85% of our patients live at or below the federal poverty level, and 46% of our patients rely on Medicaid. Medicaid is absolutely essential for our patients and for our community health center and operations, not just at Neighbor Care, but also across the state. In Washington State, there are 28 community health centers serving over 1.2 million people, which is 1 in 6 Washingtonians, and 35% of all Medicaid enrollees, which is the highest share in the country. In Washington, 56% of our community health center patients are covered by Medicaid, and those payments represent 61% of the statewide community health center revenue. Here at Neighbor Care, Medicaid represents 40% of our revenue. The proposed changes would be devastating to the Seattle community, increasing the uninsured rate by as much as 25%. In turn, this would increase demand for uncompensated care. At the same time, community health centers would lose the revenue that allows us to provide that care. Cumulative shortfalls range from about 1.1 to 2.3 billion, depending on how the changes are implemented. And approximately 150,000 to 300,000 adult community health center patients in Washington are projected to lose coverage. Changes being proposed would hit community health center patients the hardest. Our patients are more likely to have low-wage jobs, chronic illnesses, and limited support in navigating new and existing barriers to care. Our patients are likely to experience some of the greatest impacts during the preventable conditions into personal and community crises, which when people lack access to primary care. So Medicaid isn't just about coverage. It enables access to life-saving care for parents, elders, workers, and people with chronic illnesses. So in all, community health centers help control costs. A recent study showed that community health centers saved Medicaid about $38.6 billion by preventing unnecessary emergency room visits and keeping patients healthy. Weakening Medicaid doesn't just hurt patients, it weakens the entire primary care safety net and ultimately our entire community. So with that, thank you again, Senator, and happy to take any questions when the Q&A period starts. Thanks.
Thank you, Rashad. I love all those statistics. It just shows you that cutting the program isn't going to save you money. So thank you. We'll next hear from Matt Coleman, CEO of Skyline Health. Matt, thank you so much for doing this.
Thank you, Senator Cantwell, for the opportunity to speak on this critical subject and for your continued championing of healthcare and especially rural healthcare. I'm Matt Coleman. I'm the CEO of Skyline Health in White Salmon, Washington. Skyline is a critical access hospital serving a community of roughly 10,000 people. So we are indeed rural. Conversations about healthcare are about as personal as you can get. And in a rural setting, that feels even more personal. You're taking care of your friends, their families, neighbors. The types of cuts to Medicaid that are being considered would hamstring care in rural Washington and across the country. Many hospitals would be at risk of eliminating vital and what many would consider very basic services, and other hospitals would likely close their doors completely. There are published studies that would indicate that there are between 5 and 7 rural hospitals in the state of Washington that are at imminent risk of closure, and up to 18 that are at a lesser degree risk of closure. None of that is good. None of that's good for those communities, and none of that is good for Washington State. As a hospital, our primary obligation is to provide high quality and safe healthcare. Secondarily, however, we're often the most important or among the most important drivers of the economy. We tend to have the largest pay scale, the highest payroll, and we tend to employ the most people. In my community, it's about a $17 million payroll. We also contribute somewhere around $3 million in purchase services from local vendors every year. Those dollars make a difference in my community. And if they were to be curtailed in any way, the impacts would be manifold, would be multiplied, as Senator Cantwell referred to earlier. About 10% of Washingtonians live in non-metro areas. So that's about 781,000 or so people that would, in rural settings, that would be disproportionately affected by reductions in services. And what I mean by that is you don't just have the opportunity when you live in White Salmon to drive a few blocks extra and go to the next hospital. You're talking about a drive that in the best of conditions might be 60 or 90 minutes. That is a disruptive burden for many families. And it would lead to their delay or possible just outright deferral of healthcare altogether. To me, that's not acceptable. I also know that it's not acceptable to other members of our community. Recently, I was able to present Senator Cantwell and Representative Newhouse with a letter that was signed by many elected officials and community members, including Republicans, elected Republicans in my district and throughout the state, who are asking Congress to be very careful about what they do with Medicaid, to consider the consequences, to be very thoughtful, and to understand that you're messing with something that is a very intimate and relied on part of people's lives every day. And I don't think any of us wants to see access to healthcare be any more diminished than it currently is. Hospitals across Washington are struggling financially. Hospitals across the United States are struggling. And as Senator Cantwell stated in her opening remarks, Medicaid makes up a large percentage of the funding that we count on. What we're asking for is stable funding to allow us to do our jobs, to allow us to take care of our communities. Excuse me. In my hospital, Medicaid accounts for about 20% of our revenue. And honestly, at current funding levels, Medicaid doesn't even pay for the cost of us delivering the care. At the current funding levels, we get about 85 cents on the dollar for the work that we do. If some of these cuts that are being considered go into effect, that would drop as low as 50 or 55 cents on the dollar, which would mean that we would have decisions to make, just like other hospitals would. And I do not want to be in a position to have to make those decisions. In conclusion, Skyline Health agrees with Senator Cantwell that these cuts to Medicaid are not wise. And I believe that is supported by large segments of our community. Washington State Hospital Association is currently circulating a letter of their own, similar to the one that I drafted for Senator Cantwell and Representative Newhouse. And they are also gathering substantial support from elected Republican officials across the state, urging Congress to be wise with their decisions and to not focus on additional Medicaid cuts at this time. Thank you.
Thank you, Matt. Thank you so much for your leadership and advocacy here. Another big rural hospital serving a big chunk of our area, Kim Cliff, thank you so much, CEO of Tri-State Health.
Yeah, thank you. Thank you for giving us the opportunity to speak about this really important topic. Tri-State we are a rural facility. We're located in the southeast corner of Washington State, and we are a border facility. So we serve patients not just in Washington, but also in Idaho and Oregon. And as we know, these potential cuts to Medicaid don't just affect and impact Washington residents, but individuals across the country. And I think that it is an exponential adverse impact to facilities that serve individuals across state lines, such as Tri-State Health. We draw patients from about a 100-mile radius. So while our immediate service area has about 30,000 community members, our draw is much larger. And that is because some of these extremely rural communities have very little access to healthcare. And so they come to our facility to seek that care, and they rely on us to provide that care to them. About 30% of individuals in our community are Medicaid eligible, and that is higher than the state average. Greater than 70% are either on Medicare or Medicaid, and oftentimes they're served by both plans, which means that they're an aged individual with extremely low income and rely on both of those coverages to provide coverage for their necessary health care. We know that when individuals lose healthcare coverage, they tend to delay care. And so individuals that have chronic conditions, we see over and over again that they ignore the warning signs of advancement of their disease state. And what ends up happening is they land in our emergency room, and they're past a point with the acuity of their illness for us to be able to treat them here locally. And we end up transferring them out of area, sometimes as far as Oregon and Montana, when our other more local and accessible tertiary facilities are at or beyond capacity to accept the transfers. And so we know that that is a huge adverse impact to both those patients that have to leave this community, as well as their family members that are such a critical component to their care team. We know that patients delay preventative care. When they don't have coverage, they put off necessary surgeries or procedures. And again, what ends up happening is they end up in our emergency room, much more advanced in their illness, which ends up costing us more in the long term to provide care for that patient than had it otherwise. And even with the availability of charity care, we still see this perception of limited access to care persist, regardless of how much we communicate the access to that program. Individuals who are dropped off of Medicare or Medicaid coverage are often challenged with finding alternative coverages. Financially viable options are limited for them. And ultimately, the administrative burden of helping individuals find and obtain insurance coverage falls on hospitals. We often have staff that are on site and available and required to assist patients with navigating this incredibly complicated healthcare system. But at the end of the day, what we see, the ultimate result is that our charity care, our uncompensated care, grows tremendously. And Medicare and Medicaid patients are not mobile in accessing healthcare. So traveling 2 to 4 to sometimes 5 hours out of their immediate area for necessary healthcare isn't something that's feasible for them. Rural facilities, such as Tri-State, we're tasked, and we take very serious the mission of keeping care local, and we rely on all healthcare payer sources to support this effort. So while we know that Medicaid, as you heard from Matt, does not generally cover 100% of the cost of providing necessary healthcare coverage, the alternative for us is no funding. And what this ultimately leads us to do is to have to make really tough decisions on whether or not we can keep critical service lines open to care for this population when funding becomes diminished. So again, Tri-State, I would say, supports this effort to keep Medicaid funding as robust as possible so we can continue to serve this population.
Thank you. Thank you so much. Thank you so much for participating. Lynn Kimball, who is Executive Director of Aging of Long-Term Care of Eastern Washington.
Great. Thank you so much, Senator Cantwell, and thank you for your support of older adults and people with disabilities across Washington. Medicaid is such a key part of what helps older Washingtonians stay at home. It is the primary payer for long-term care. So every day at Aging and Long-Term Care, we work with people trying to navigate the complexities of Medicaid long-term care. We directly serve over 5,000 of the 105,700 people in Washington state getting long-term care in their own homes. This means making sure people have a paid caregiver in place to help them with essential daily tasks that many of us take for granted, things like bathing, dressing, shopping, cooking, and more. And we regularly get calls from families trying to figure out where to begin and how do they make it through already complex Medicaid eligibility processes. These proposed changes will add to the challenges that people who are sick and need our help will have to navigate in order to get and to maintain their care. The complexity of navigating work requirements, exemption processes, and making it through eligibility twice a year adds stress, frustration, worry, and ultimately will mean that people who legitimately need the care won't be able to maintain it any longer. This also means that my staff, who should be spending their time helping people get the support they need to stay at home, will need to spend extra time just trying to assist people to maintain their eligibility. Not everybody has family support to help, and not everybody can navigate it on their own. These changes just add unnecessary administrative burden that families and caregivers will have to navigate, or they'll end up without essential care and support. And people who end up without care will end up in other settings, nursing homes, emergency rooms, and hospitals. If you can't get help with bathing and you fall and you break your hip as an older adult, you will end up in the ER, hospitalized, and in a nursing facility for rehab. If you survive, you will now need more care than you did prior to breaking your hip. These proposed cost savings to the Medicaid program will cost so much more in terms of people's lives and in medical costs. Thank you so much.
Thank you for outlining how the care doesn't disappear. It just gets more expensive. Thank you so much. Dr. Isaki, thank you so much for joining us.
Thank you, Senator Cantwell, for the opportunity to speak today and everything you do to keep Washingtonians healthy. As a physician and researcher, I've seen firsthand how cancer doesn't just affect a patient, it affects their families, caregivers, and communities. For many, especially those with lower income, Medicaid is a lifeline, not just for cancer treatment after diagnosis, but for preventative care, which can detect disease early and save lives. First, I'll talk about the impact of potential Medicaid cuts on cancer treatment. Then I will discuss the impact on cancer prevention. For a few minutes, I want you to put yourself in the shoes of a cancer patient. Imagine being told for the first time that you have cancer. Imagine all the questions that you might have. Is it treatable? How much time do I have? And how do I tell my family? These are the real questions that my patients wrestle with after a cancer diagnosis. Now imagine during what is possibly the hardest time of your life, learning that you could lose your health insurance if you are not able to work. Cancer patients already face multiple hurdles. After diagnosis, treatment schedules are demanding and physically exhausting. Many cancer patients can't work during chemotherapy or when we're recovering from surgery. And their caregivers, who are often family members, are equally stretched. Requiring cancer patients to work to maintain health coverage adds additional stress and risk cutting off access to care exactly when they need it most. Now let's talk about the impacts on preventative care. Research shows that Medicaid-funded cancer screenings, like colonoscopies, catch disease early when treatment is more effective and less costly. As an example, my research focuses on the reasons why people do not complete colon cancer screening, which is arguably the most preventable cancer. Having consistent access to health insurance is one of the strongest predictors that a person will get screened. By restricting access to Medicaid, preventive screenings will go down for those who are unable to work or unable to work the proposed amount of time. If we truly care about improving health and reducing costs, we should focus on expanding access to preventative care, not restricting it. Denying access to preventive cancer screenings does not save money, but rather it shifts the burden downstream to more advanced disease, more suffering, and more costly interventions. As legislators consider the current budget bill, I urge you to protect Medicaid's role in cancer care and prevention. Adding additional burdens to cancer patients or those trying to prevent its onset will only increase deaths here in the state of Washington and nationally. Thank you.
Thank you so much. We'll now hear from our last speaker, Jacqueline Blanco.
Thank you. Thank you, Senator Cantwell, and thank you to my other panelists for standing with patients and providers in defense of Medicaid. I'm here as a clinician, but I also recognize a lot of my own lived experience and everything that you all shared, so I really appreciate it. I'm a labor and delivery nurse by practice, and I function now as a clinical nurse manager at a community district hospital here in King County, where we deliver just under about 5,000 babies annually. So we have a high delivering volume. And we recognize that of our county, nearly 1 in 4 residents here are Medicaid enrollees. I'm also an active member of the Association of Women's Health Obstetric and Neonatal Nurses, which is our national governing body for our practice. And together as a profession and as a practice group, we are working hard to take a strong public stand against the proposed cuts because we know that our country is in the middle of a maternal health crisis. I am remiss to not share every time I have the opportunity to do so that the US remains the least safe developed nation in which to give birth, and that it was statistically safer for my mother to deliver me than it would be for me to have a child, which is not the direction that we want to be headed in. Cutting Medicaid will only exacerbate that. It will worsen this maternal mortality crisis, deepen racial disparities, and ultimately set us back. And I think it's really critical to note that Medicaid is not just a safety net, it really is foundational. 42% of all births in the US are covered by Medicaid. So this isn't a niche issue. It's a core part of how our maternal health system functions for everyone. When Medicaid is destabilized, so is the financial viability of our hospitals, which you all have spoken to beautifully today, especially hospitals like ours, that is a community district hospital or some of the critical access hospitals that are present. Medicaid really supports the reimbursement infrastructure that brings all birthing people present and dependent on regardless of their insurance status. I also want to call out that the Medicaid work requirements are particularly disconnected and ultimately inhumane. They do not represent the lived experience of new parents. Just imagining a postpartum person who is recovering from a C-section, managing round-the-clock newborn care, possibly facing complications of hemorrhage or infection, navigating sleep deprivation, and needing to prove that they're working to maintain their health coverage is not viable. This extends even further to folks who potentially had a miscarriage or an unplanned pregnancy loss, adding a lot of bureaucracy into what is already challenging. The system is extremely strained already. I also organize the Smooth Transition Programs, which works with EMS, midwives, and community practitioners who really are holding the line in this system that is broken already. And I would just like to acknowledge those. I really want to ask for the support of investment rather than austerity, and working for equity rather than exclusion. And I'm thankful to all of you who are helping us protect our pregnant people, babies, and the families who are most vulnerable. Thank you.
Thank you. What a great group of people to explain how devastating these cuts could be and why they're senseless and not saving on costs. So hopefully we'll take questions now, Sophia.
Fabulous. If folks could go ahead and use the raise hand function and then also identify their name and outlet in the chat, and then we'll go through and try to get through as many people as possible. Thanks. Awesome. We're going to go to Bill Lucia from the Washington State Standard first. Bill, I'm going to go ahead and unmute you and you can go ahead and ask your question.
Yeah, thanks a lot for taking my question. This is a question for Senator Cantwell. One of the provisions in the reconciliation bill would specifically reduce the federal match rate for states that cover undocumented immigrants with state-funded Medicaid-style programs. Just wondering if you had any comments on that provision in particular, or any thoughts on, whether the state should continue down the path of offering that coverage if it puts federal funding at risk.
I don't like sick people in my community that don't get treatment. So why do I want sick people in my community without treatment? What if it's COVID? What if we were in COVID again and people didn't have care? What if it was a measles outbreak? What if it was, why do I want people in our community that don't have access to treatment and care? So this is about the safety of the community. So I think this is a wrong-headed provision. And certainly, with our health clinics, we've tried to do so many things to stop this in general, this kind of tactic, because we want healthy communities. But we definitely don't support the House provision.
Thanks, Bill. Do we have any other questions on the line? All right, we're going to go ahead and go to Elise from Seattle Times.
Hi, all. Can you hear me?
Yep, loud and clear, at least.
Okay, great. Thanks so much, Senator Cantwell, and everyone for being here. This question is for some of the CEOs on the line. Just wondering what kinds of conversations, if any, you're all having with other leadership about possible service closures. What's most vulnerable here, and is that something that you're all thinking about right now with some of these cuts looming?
Elise, thanks for the question. I can take an initial kind of stab at that. Yeah, hospitals like ours provide all kinds of services, some of which have a margin to them and make us a little bit of money, and some that do not. Unfortunately, some of those services which make very little money or even lose money for us are necessary in our communities, and they would be the most vulnerable services if we had to make some changes. I think a point that also needs to be emphasized is that those services go away for everybody in the community, not simply those who have Medicaid or do not have Medicaid insurance any longer. They will go away for everyone. Skyline does not deliver babies, but there are several rural hospitals in the state of Washington that do, and those labor and delivery programs are already on the cusp of unviability and could absolutely go away. And I think that most of us would consider that that's very basic care to provide to a community. And unfortunately, some of those programs could be at great risk.
Yeah, and I can jump in and just say that, as a community health center, we've been in partnership with the federal government for 60 years now. We just turned 60 in 2025, right? And we're mandated to see any and everyone, regardless of ability to pay, right? So it's incumbent upon us to continue to find, and common ground to what we truly believe are aligned goals, as the senator mentioned, of ensuring that we have healthy people in our communities. A healthy community is a civically engaged community. A healthy community is a productive community, and it's much more challenging to do that if there are further barriers to important access for healthcare services that should be a right for our communities.
I don't think we have anybody on the call from the Hospital Association, but I think their original estimation was that 5 to 7 facilities in our state could close.
That's yes.
All right, wonderful, folks. Is going to give a final call for questions here if reporters would like to use the raise hand function and identify their outlet.
Or just jump on. Sometimes it's easier to get the volume going than it is your raised hand.
Okay, I'm not seeing any other folks jumping in, so I'll turn it over to the senator for any closing thoughts.
Well, thank you again. You guys did a fabulous job of outlining why the costs will go up in such detail. I so appreciate it. And so appreciate the just articulation in general of why this idea is just so wrong-headed. And, I don't know that everybody understands how big Medicaid has had as an impact on society and driving down the cost of care. And certainly is not the time to make care more expensive, and not the time to make the setting of delivery of care more expensive or cut back on service. So thank you all for voicing the experiences that you're dealing with. Thank you for your advocacy, and we'll continue to try to illuminate and fight the mess that is going to be made of Medicaid if this succeeds. So hopefully, just as we stopped block granting of Medicaid, hopefully we can be successful here too. Thanks, everybody.